Vital signs, blood pressure. The videos of SWOT Nurse Notes serve as worded explanations and for demonstration purposes only. These notes are based on the owner of the channel's understanding. The channel's purpose is to assist with studying and to help with adapting to the UK clinical setting. These notes are short and simple for persons to better have a foundation knowledge to build on. This, however, does not serve as a specific guide to the NMC OSCE and CBT exams. Hi everyone. I am Nurse SWOT, the owner of the channel. Today we will be looking on vital signs. To be more specific, blood pressure. Let's begin. Measurements of the 5 basic functions can be influenced by a number of factors. These can include age, medications, health conditions, and the environment. It is also used to assess one's general health and monitor treatment effectiveness. Measuring and recording clinical observations and calculating National Early Warning Score 2 can appear in the OSCE exams. You will be expected to correctly record these observations on the News 2 chart after the completion of vital signs during the assessment station. There are 5 basic functions that you are expected to assess during the assessment station of the OSCE exam. These include 1. Temperature, 2. Blood pressure, 3. Pulse rate, 4. Respiratory rate, 5. Oxygen saturation. Now, what is blood pressure? Well, it is the measurement of the force of blood inside the arteries. There are 2 numbers that represent the pressure. When the heart beats, this is known as systolic, and when it relaxes, this is known as the diastolic. Types of blood pressure machines? Do you remember their names? You have the automatic blood pressure machine and the manual blood pressure machine known as the sphygmomanometer. Now, let's discuss blood pressure readings. High blood pressure entails a diastolic reading greater than or equal to 90 mm of mercury and a systolic reading greater than or equal to 140 mm of mercury. Note carefully, this is only if reading was taken at a pharmacy, GP surgery, or clinic. If readings are done at home, with a diastolic reading greater than or equal to 85 mm of mercury and a systolic reading greater than or equal to 135 mm of mercury, it would also be considered as high blood pressure. Severe high blood pressure entails a diastolic reading greater than 120 mm of mercury and a systolic reading greater than 180 mm of mercury. Note carefully, this is only if reading was taken at a pharmacy, GP surgery, or clinic. With this reading, urgent medical interventions will be needed. Normal blood pressure readings has a diastolic reading between 60 to 80 mm of mercury and a systolic reading between 90 to 120 mm of mercury. Note carefully, this is only if reading was taken at home or at a pharmacy, GP surgery, or clinic. For the age group 80 and over, due to physical changes of the arteries, get stiffer. The ideal blood pressure reading that would be considered normal for this age group and over would be less than 150 mm of mercury over 90 mm of mercury. Note carefully, this is only if reading was taken at a pharmacy, GP surgery, or clinic. If done at home, less than 145 mm of mercury over 85 mm of mercury. A reading of 89 over 59 mm of mercury or lower is considered low blood pressure. Pre-hypertension, however, are readings between 120 over 80 mm of mercury and 140 over 90 mm of mercury. Being at this level will prompt individuals to start practicing healthier lifestyle to lower the risk of developing high blood pressure. For the OSCE exams, Follow these steps for accurate blood pressure measurements. Instruct the patient or client to extend arm, preferable the left arm. Query if any surgery was done on the arm. If the selected arm is suitable for use, place the blood pressure cuff 1 to 2 centimeters above the elbow crease or the cubital fossa. Ensure the cuff is snug, but not too tight. You should be able to fit 2 fingers underneath. Align the cuff with brachial artery that runs along the inner side of the forearm. Keep the forearm at the same level as the heart. Ensure the arm is relaxed with legs extended, lying position. Ensure the arm is relaxed with feet flat on the ground, sitting position. Press start on the automatic blood pressure machine. Please note that the procedure is slightly different when using a sphygmomanometer. You are required to do the vital signs at the assessment station. The assessment station is 20 minutes. After completing each vital signs, always state if the readings are within or not within the normal range. Document readings on the National Early Warning Score 2 chart before the 20 minutes is finished. Based on the NEWS 2 score, please indicate verbally the monitoring frequency hours and if escalation of care will be done. Explain the rationale behind escalating or not escalating care. Remember to write the date, time, your initials, and signature where required. Document correctly on the National Early Warning Score 2 chart. One simple error will be an automatic fail for the assessment station. Remember, if readings or findings are abnormal, you are expected to escalate care. Read charts carefully to ensure you're writing in the correct section. The frequency of monitoring of vital signs for care plans are based on the National Early Warning Score 2 total score. Recheck as often as possible to ensure you have completed charts correctly. Remember, vital signs are a part of the assessment station. You can decide whether to do it before or during the AT assessment, fulfilling the criteria. Remember to manage your time. Now, how do you document the blood pressure reading on the NEWS 2 chart? First, look for the section that states C, blood pressure millimeters of mercury. Score uses systolic BP only. The C stands for circulation. Please note carefully that only the systolic blood pressure reading is used for the NEWS 2 score chart. Second, based on the systolic blood pressure reading, look for the row and column in which the reading belongs. Note carefully that the readings are set within ranges on the NEWS 2 score chart. At the end of each row, there may be a score. Score can be from 0 to 3. Now let's use examples. Example 1. Let's say that you have a systolic blood pressure reading of 234 millimeters of mercury. Where would you write this reading? As seen on the NEWS 2 chart in red. You would write this in the section, row, of systolic readings, greater than or equal to 220 millimeters of mercury. Why? Because the systolic reading 234 millimeters of mercury exceeds the range of what the NEWS 2 score chart states. Please observe that the score at the end of this row is 3. You can either write on the chart using numbers, or you can place a dot in the required section to signify where the reading would fall. Example 2. A systolic reading of 90 millimeters of mercury. Where would you write this reading? As seen on the NEWS 2 score chart in black. You would write this in the section, row, of systolic readings 81 to 90 millimeters of mercury. Why? 90 milliliters of mercury fall within the range 81 to 90 milliliters of mercury. Please observe that the score at the end of this row is also 3. I hope this was clear. A full video will be done on how to chart on the NEWS 2 score chart in full. Please subscribe to channel to get post notifications. Thank you for watching.